Diabetes affects an estimated 30 million Americans.
That is a ton, and even more staggering are the costs, maybe $245 billion every year. Here to talk about how digital healthcare and how it could maybe help with all of this is our health expert and medical expert, Dr. Mindy Romero with SSM Health. Thanks for being here this morning.
Yeah, great to be here.
So I think first and foremost, what do we mean by digital healthcare, and how is it helping people check in with maybe any condition, including diabetes?
Absolutely, and this is such a pertinent topic since November is National Diabetes Month. So this is a great time to talk about this chronic illness, like you said, that affects over 30 million people. Billions and billions of dollars of healthcare dollars, individual dollars go into this. So we use technology for amazing things. Our Facebook, our Instagram, watching our favorite sports teams, kids playing games online. But it's time now for healthcare to really join this digital revolution. And so this is a very interesting study that showed that diabetes, which is considered a very chronic illness, does affect so many millions of people, but so many millions of people don't have the access to the care that they really deserve and could benefit from. The best way to really fight diabetes in this growing number and this chronic disease is to prevent the condition. So of course there's task forces and the government's involved, doctors are involved, and one of the programs is a diabetes prevention program. And so this tech company basically did a study where they showed that in that preventative phase, if patients had access to basically lifestyle changes by meeting with coaches, even via digital programs, lifestyle changes, encouragement, stress reduction, those numbers showed results in decreasing blood sugars and decreasing your risk for diabetes.
Usually computers are linked with maybe not so great health effects, but this is one of those rare cases, it seems like.
It's one of those cases where they were able to show maybe it decreases funding and really gives patients access, and because it's such a long drawn-out program, it encourages patients to really follow lifestyle modification. What's really interesting here is it kind of goes against the pharma model, which says, here, take a pill, do an injection, do these kinds of things. It kind of goes back to the adage, make those lifestyle changes, lose the weight, get out there and have really a support system, even if it's just the technology.
I wanted to switch gears a little bit to the topic of colon cancer, and being somebody who's in their upper 40s right now, every time I go to the doctor, we're having this question about whether it's testing time.
Right.
Usually it's 50 years old is what I've been told, and I haven't had that test yet, but there's new research out showing maybe I should think about doing it sooner.
Yeah, so the gold standard right now is after the age of 50 or at the age of 50. That's the time to really begin that colon cancer screening in asymptomatic individuals. This is a study that says maybe we should be starting that at the age of 45 to 50, maybe 5 years earlier. The reason is that it showed that people in their age category, 45 to 50, that did have routine or colonoscopies were showing some growths. Not necessarily cancerous, but maybe precancerous, maybe some of them were cancerous. In the 40 to 45 age category, so even 5 years prior to that, those growths were significantly reduced. So maybe that's overkill. The question here and the study flaw might be that these people in the 45 to 50 year age category were being referred for a colonoscopy for some sort of symptom. So the question becomes, is it all 45 to 50-year-olds that really need that screening? If you're asymptomatic, Adam, you don't really have a family history, you don't have a disease process that makes you high risk, is it overkill to start 5 years earlier? Or is this study saying, well, maybe we should be looking earlier, because like so many cancers, the earlier we detect it, the better chance we have of fighting it and giving people better survival rates.
A lot of folks here in Madison following this, obviously, with Exact Sciences being so prominent in our community. It's good to see you. Thank you so much.
Great to be here.
News 3 this morning. I'll be right back.